Let's talk about skin scarring and black skin in particular. If you have skin and you put a blade in, and there is a wound gap. And now we are closing this wound gap mechanically by putting sutures in place, and then the magic which fascinates me on a daily basis happens, which is called wound healing. Think of a scar like a biological superglue that needs some time to dry. However, scar tissue is not skin. It doesn't grow hair, it doesn't have sweat glands, it doesn't have any sebaceous glands. It ideally looks like skin, and it's easier to resemble the kind of skin in white skin because scar tissue has another factor that skin doesn't have, and this is pigments. Getting a great scar on black skin is a little bit more challenging because, again, scar tissue doesn't contain pigmentation. It's brighter. Black skin generally has a tendency to be a little bit softer. This is why aging in a black face is so much more generous in terms of looking great for so many more decades, while I look like a white version of a Yoda. It's great for aging, but it's equally difficult for scarring because the skin is so soft. So there's a greater chance of stretching. And what happens if the scar stretches? You see a brighter line. Now, what can you do? Obviously, there are techniques in surgery to stabilize the scar additionally, and in that way hoping that there won't be any chance for stretching later. If you do a facelift, obviously the stabilization has to be done accordingly. If I do a halo, I do a halo and secure the scalp to the bone in a white person. When I do it on a black person, I equally secure the forehead to the same bone anchoring or bone tunnels to make sure that it's a bivectorial stabilization of the scar. So you work extra to allow the skin to be as it is. However, if there's still a little bit of scar visibility, and I'm speaking of the white line or the brighter line on black skin, the best solution, if everything else looks great, the scar is flat, etc., is actually what I call medical tattooing or permanent makeup. So you should wait at least 9 months, ideally a full year, using just makeup to cover it up. And then you go to a specific clinic that is focused on that, and they do a couple of tests to get the right pigment. They tattoo the scar, and with this, everything is taken care of.